Ready for another deep dive? This time, we're heading to Sudan, to the world of healthcare.
Oh, interesting.
Yeah. Specifically, the challenge of accessing medical history there. It's,
I can imagine.
it can be pretty tough, right?
Yeah.
We've got this master's thesis someone sent us, and it aims to.
Oh, wow.
Yeah, it's pretty ambitious. It's looking at like a whole new electronic medical records framework for Sudanese hospitals. So we're talking about, moving away from the paper-based system they've got now.
Wow, a complete overhaul.
Yeah, pretty much.
Yeah.
And it's a situation that resonates with a lot of developing countries, actually.
Absolutely, yeah. Many countries are grappling with those same hurdles with paper-based systems.
Yeah, exactly. So if this framework works out, it could be
A model.
yeah, like a blueprint for
Yeah.
other countries facing
Huge implications.
huge implications. Yeah.
Yeah.
And think about it like doctors, in a rural clinic trying to find a patient's file,
Oh, yeah.
or like critical information just getting
Lost.
in a mountain of paperwork.
Absolutely.
It's a real
Yeah.
it's a real problem.
a huge problem.
And this thesis really digs into how to build a system
Okay.
that could change all that.
Interesting.
Now, what I found really impressive is this researcher, they didn't just try to digitize
Yeah.
the existing forms. They really thought about it.
They took a step back.
They did. They took a step back and asked, like, what data do we actually need for holistic patient care, specifically in Sudan?
Yeah. What's essential?
Yeah, exactly.
Yeah.
And they went deep. They looked at like Ministry of Health forms. They interviewed doctors. They even looked at
Wow.
what other countries are doing,
Oh, interesting.
like India and Kenya.
Yeah.
Places that have already kind of gone through this EMR implementation.
Right. So they were really, really thorough and grounded in real world needs.
Yeah, very methodical and really understanding the system that they were trying to help with.
Absolutely.
So what did they find? What kind of data items
Okay.
did they focus on?
You've got the usual things, the demographics, the patient's history, medications, lab results, diagnoses.
Right, the basics.
The typical stuff, but there's one that I found really interesting,
Oh, so see.
economic status.
Now that is not something you typically see in a medical record.
Right.
So why was that so important for them to include?
Well, it acknowledges that health is not just about
Right.
biology. It's also affected by
Social factors.
social determinants, like income, education, access to resources,
Yeah.
all of that.
It's a more
Holistic picture.
holistic view, yeah.
Yeah.
And so by including that, you can start to
Exactly.
identify
Yeah.
trends and vulnerabilities.
It's actually you can see the bigger picture.
Yeah, absolutely. So they were thinking big
Right.
with this system, and then they had to pick like the technology to.
Right. They went with a .NET framework for the user interface and a SQL Server database.
Okay, now I know we've got some techie listeners out there.
Yeah.
Was that the right call? I mean, were there
It's a good question.
any limitations or trade-offs with using those technologies?
Well, I mean, .NET, it's a robust framework,
Right.
but it can be a bit resource intensive, right? And that could be a challenge for some hospitals. Maybe they don't have the most powerful computers.
Limited resources.
Yeah. But on the other hand, a lot of developers are familiar with .NET.
Oh, okay.
So it might make the transition easier,
Right. So familiarity versus
Yeah.
maybe some resource constraints.
Exactly. And then there's SQL Server,
Okay.
which is, it's a very reliable database, but you have to pay for the license.
Oh.
So that's something to consider, those costs.
Yeah. Those are important considerations.
Yeah.
So they really had to
Strategic decision.
be strategic about what they were doing.
Yeah.
So what were some of the key features they built into the system to really leverage?
Okay, so one feature that stood out to me
Okay.
was the data export functionality.
Okay.
They made it so you can easily export the data into standard formats,
Oh,
like Excel and PDF.
oh. Okay. So it's not just about keeping the data.
It's about making it usable.
Yeah.
Exactly. You can share it easily.
Right.
Which is
analyze it.
exactly
Yeah.
crucial for research, for reporting to the Ministry of Health, even sharing data with international organizations.
Oh, that's huge.
Yeah.
You can imagine like tracking disease outbreaks or seeing if a public health program is working.
Exactly.
Just like with a few clicks.
Yeah. It opens up a whole new world for understanding and improving health outcomes in Sudan.
That's amazing. But, building a system's one thing.
Right.
Getting people to actually use it.
Yeah.
That's a whole other challenge.
Absolutely.
So how did the researcher address that?
So they actually tested it out in real hospitals in Sudan.
Oh, wow.
Yeah. They had doctors and medical staff try it out.
Okay, so real-world testing.
Real-world testing.
Yeah.
And they gave feedback.
So what was the verdict from the people who would actually be using it?
It was really positive. They loved it.
Really?
Yeah. They found it easy to use, efficient.
Wow.
And they thought it would really lighten their workload and improve patient care.
That's great. That's a really good sign.
It is. They were very enthusiastic about it.
That's fantastic. So it sounds like they were off to a good start.
Yeah, definitely.
With this project.
Yeah.
But there's always more to the story, right?
Oh, absolutely.
We've only just scratched the surface.
Yeah, we've got to dig deeper.
So let's keep exploring this fascinating thesis and see what else we can uncover.
Let's do it. I think one thing that really struck me was how much they focused on making it user-friendly.
Yeah, I was going to say that's got to be key, right?
Absolutely.
I mean, you can have the most amazing system.
Right.
But if it's a pain to use...
Yeah, nobody's going to use it.
Doctors are busy.
Exactly.
They don't need extra headaches.
Well, they've got enough on their plate.
Right.
So they really designed it with the end user in mind. So think like drop-down menus, autofill functions.
Oh, lucky to make it easier.
Yeah, make it really smooth and intuitive. And they even used clear data visualizations.
Oh, that's smart.
Yeah.
So it's not just like a wall of text.
No. They wanted it to feel like a helper,
Like an assistant.
Yeah, not another burden.
I like that.
Yeah.
An assistant. But, okay, user-friendliness is great.
Right.
But what about security?
Oh, that's huge.
We're talking about medical records here.
Sensitive information.
This is really important stuff.
Absolutely. And the thesis, it really stresses that. A multi-layered approach to security.
Okay.
They talk about encryption, strong authentication, regular audits.
Oh, wow. So they're taking it seriously?
Very seriously.
Keeping that data safe?
Like a digital fortress.
I like that.
Yeah.
A fortress for your data.
Exactly.
And that's especially important, I think, because in Sudan,
Right.
the laws around data privacy, maybe they're not as...
They might be developing still.
Yeah, they're maybe not as mature as in some other places.
Right, so they were really thinking ahead.
They were thinking ahead, yeah.
Yeah, anticipating future needs.
It's like they're laying the groundwork for a system that can grow.
Exactly.
And adapt as things change.
Absolutely.
Which is really important. And those might seem obvious.
Yeah.
But a system like this, it can't exist on its own, right?
No, it needs to connect.
How did they think about integrating this?
EMR with the rest of the healthcare system.
So the key word here is interoperability.
Okay, what's that?
It means that different sisters can talk to each other.
Oh, okay.
Seamless communication.
So like the EMR could talk to
the lab, the pharmacy.
imaging centers.
Yeah, all of that. Everything connected.
No more like faxes and phone calls.
Yeah, no more lost paperwork.
That would be amazing. Imagine a doctor orders a blood test.
It goes straight to the lab.
The results come back.
Straight into the EMR.
Automatically.
Automatically. And if there's any follow-up,
It just happens.
it just happens.
Yeah.
No manual intervention.
That's incredible. It's like a
well-oiled machine.
a well-oiled machine and so much less room for error.
Exactly. Efficiency and safety all in one.
That's a powerful combination.
It is.
But taking a step back, what were some of the core principles behind this framework? Like what were they really trying to achieve?
Well, one of the big ideas was data centralization.
Okay, tell me about that. They wanted a system where information wasn't stuck in individual hospitals or clinics.
So it's accessible.
Yeah, across the entire network.
So like if you have to go to a different hospital,
Your records are there.
they're right there.
Right there.
That's pretty amazing.
Yeah, no more scrambling for lost files.
Especially in an emergency.
Especially in an emergency. You need that information fast.
That could be life-saving.
Exactly.
Wow. But to do that, to connect everything like that,
Right?
that takes some serious infrastructure, right?
Does. They talked about needing robust networks, secure networks.
Yeah, especially in a country like Sudan.
Right, with geographical challenges.
Huge country.
Yeah, and different levels of technology in different areas.
Yeah.
It's a big undertaking, no question.
Huge undertaking.
But the potential payoff is huge, too.
It's like building an information superhighway for healthcare.
Exactly.
Okay, so centralization, that was one big thing.
Yeah.
What else? What are the principles that they focus on?
Standardization was another key one.
Okay, what does that mean in this context?
So if you want to share data easily and analyze it, it needs to be structured the same way everywhere.
Oh, okay, so it's all consistent.
Yeah, consistent. No more deciphering handwriting.
Or different abbreviations.
Right. They talked about using standardized medical terminologies.
So everyone's speaking the same language.
Exactly. Same data language.
That makes sense.
Yeah. It minimizes errors, ensures data integrity.
Which is so important when you're dealing with
Patient safety.
solutions come from the people.
Who are closest to the problem.
Exactly.
So they understand it best.
And it's not about, starting from scratch every time.
Right.
This researcher, they looked at what other countries had done.
Yeah, they learned from their experiences.
India, Kenya, they took those lessons and adapted them to the Sudanese context.
It's really a great example of collaboration, knowledge sharing.
Yeah, it shows that we're all in this together.
We can learn from each other.
Imagine if we had, like, a global network of healthcare innovators,
Oh, wow.
sharing ideas, supporting each other,
That would be amazing.
pushing the boundaries of what's possible.
A global community working towards better healthcare.
That's a powerful vision.
It is.
And this thesis, it's a step in that direction.
Definitely.
But, okay, let's bring it back to our listener.
Okay.
They're hearing all this.
Yeah.
What's the takeaway for them? What should they be thinking about?
I think the big takeaway is the future of healthcare.
Yeah,
It's not set in stone.
it's still being written.
Exactly. And we're all part of writing it.
Researchers, innovators,
Policymakers,
patients.
everyone.
Yeah, we all have a role to play.
Whether it's supporting research, advocating for change,
Staying informed.
even just talking about these issues.
Yeah, just being aware.
It all makes a difference.
We can create a world where healthcare is better,
More accessible, more equitable.
more effective.
For everyone.
That's the goal.
That's what we're striving for.
This thesis, it's a reminder that it's possible.
It gives us hope
And it's just one example.
with the amazing work that's happening out there.
So much innovation, so much potential.
Yeah. If you're interested in learning more, we've included a link to the full thesis in the show notes.
Definitely check it out. It's been fantastic exploring this with you.
It has. It's been a great discussion.
And to our listeners, thanks for joining us on another deep dive.
Keep exploring. Stay curious.
And until next time, stay healthy.